51. Which of the following is a potential complication of chronic sinusitis? A. Asthma exacerbation. B. Lung cancer. C. Sinus abscess. D. Pneumonia. Answer: C. Sinus abscess. Rationale: a sinus abscess is a potential complication of chronic sinusitis where infection can spread to surrounding tissues. Asthma exacerbation is common, but it's not a complication, and pneumonia or lung cancer are not typical complications of chronic sinusitis. 52. How long must symptoms persist to be diagnosed as chronic sinusitis? A. 1 week. B. 3 weeks. C. 8 weeks. D. 12 weeks. Answer: D. 12 weeks. Rationale: chronic sinusitis is diagnosed when symptoms persist for 12 weeks or longer, despite appropriate treatment. Symptoms lasting 1 to 3 weeks are indicative of acute sinusitis. 53. What is a common physical examination finding in patients with chronic sinusitis? A. Nasal polyps. B. Enlarged tonsils. C. Swollen ankles. D. Enlarged lymph nodes. Answer: A. Nasal polyps. Rationale: nasal polyps are a common finding in patients with chronic sinusitis and contribute to the obstruction of the nasal passages. Enlarged tonsils, swollen ankles, and enlarged lymph nodes are not typical findings of chronic sinusitis. 54. Which of the following is a key diagnostic feature of fungal sinusitis? A. Nasal discharge with a fruity odor. B. History of recent travel. C. Presence of black eschar in the nasal cavity. D. Positive bacterial cultures. Answer: C. Presence of black eschar in the nasal cavity. Rationale: fungal sinusitis, particularly mucormycosis, can present with black eschar in the nasal cavity. Nasal discharge with a fruity odor is associated with other conditions, and bacterial cultures would not be positive in fungal infections. 55. Which of the following is the most common symptom of chronic sinusitis? A. Tooth pain. B. Facial pain and pressure. C. Fever. D. Sore throat. Answer: B. Facial pain and pressure. Rationale: facial pain and pressure are the most common symptoms of chronic sinusitis, along with nasal congestion and discharge. Tooth pain may occur due to the proximity of the sinuses to the teeth, but it is less common. Fever and sore throat are more indicative of upper respiratory infections. 56. What is the most likely cause of chronic sinusitis in patients with cystic fibrosis? A. Viral infections. B. Allergies. C. Fungal infections. D. Bacterial infections. Answer: D. Bacterial infections. Rationale: in patients with cystic fibrosis, chronic sinusitis is most often caused by bacterial infections, particularly Pseudomonas aeruginosa. Viral and fungal infections are less common in cystic fibrosis-related sinusitis. 57. Which of the following medications is commonly prescribed to patients with chronic sinusitis to reduce nasal inflammation? A. Antibiotics. B. Nasal decongestants. C. Oral antihistamines. D. Nasal corticosteroids. Answer: D. Nasal corticosteroids. Rationale: nasal corticosteroids are commonly used to reduce inflammation and swelling in the nasal passages, helping to improve sinus drainage. Antibiotics are used if a bacterial infection is present, and nasal decongestants and antihistamines may provide temporary symptom relief, but are not the primary treatments. 58. Which of the following should be avoided in the treatment of chronic sinusitis due to potential for rebound congestion? A. Nasal saline irrigation. B. Nasal corticosteroids. C. Oral antibiotics. D. Nasal decongestants. Answer: D. Nasal decongestants. Rationale: nasal decongestants, when used for more than a few days, can cause rebound congestion, worsening symptoms over time. Nasal saline irrigation, nasal corticosteroids, and oral antibiotics do not typically cause this issue. 59. In patients with chronic sinusitis, which of the following is most likely to contribute to persistent symptoms? A. High fluid intake. B. Poor sleep hygiene. C. allergic rhinitis. D. High-fiber diet. Answer: C. Allergic rhinitis. Rationale: allergic rhinitis often coexists with chronic sinusitis and contributes to persistent symptoms by causing additional inflammation and nasal congestion. Poor sleep hygiene and diet factors are less directly linked to the persistence of sinusitis symptoms. 60. Which of the following is the primary method of managing fungal sinusitis? A. Antibiotics. B. Antifungal medications. C. Antihistamines. D. Nasal corticosteroids. Answer: B. Antifungal medications. Rationale: fungal sinusitis is treated primarily with antifungal medications, which target the specific fungal pathogen. Antibiotics are ineffective against fungal infections, and antihistamines or nasal corticosteroids are not sufficient treatments for fungal sinusitis. 61. What is a common trigger for chronic sinusitis in patients with allergic rhinitis? A. Dust mites. B. Stress. C. Lack of sleep. D. Vitamin deficiency. Answer: A. Dust mites. Rationale: dust mites are a common environmental trigger for allergic rhinitis, which can then exacerbate chronic sinusitis. Stress, lack of sleep, and vitamin deficiency are less commonly associated with the development of chronic sinusitis. 62. Which of the following is a typical finding in the sinus cavity of a patient with chronic sinusitis? A. Clear mucus. B. Green or yellow mucus. C. Bloody mucus. D. Thick, purulent discharge. Answer: D. Thick, purulent discharge. Rationale: thick, purulent, pus-like discharge is commonly seen in chronic sinusitis, indicating ongoing inflammation and infection. Clear mucus may be seen in viral infections, while green or yellow mucus often indicates bacterial infection. Bloody mucus is less typical. 63. Which of the following treatment options is most appropriate for chronic sinusitis with nasal polyps? A. Oral antibiotics. B. Nasal corticosteroids. C. Topical decongestants. D. Antihistamines. Answer: B. Nasal corticosteroids. Rationale: nasal corticosteroids are effective in reducing the size of nasal polyps and alleviating symptoms in patients with chronic sinusitis. Oral antibiotics and topical decongestants may help control infection or congestion but do not address the polyps. Antihistamines are used for allergic rhinitis, but are less effective for sinusitis. 64. Which of the following imaging techniques is most useful in assessing the severity of chronic sinusitis? A. Chest X-ray. B. Sinus CT scan. C. MRI of the brain. D. Ultrasound of the sinuses. Answer: B. Sinus CT scan. Rationale: a sinus CT scan is the gold standard for assessing the severity and extent of chronic sinusitis, as it provides detailed images of the sinuses. Chest X-rays, MRI, and ultrasound are not ideal for assessing sinus pathology. 65. Which of the following is a characteristic of bacterial chronic sinusitis? A. Mild symptoms that resolve within days. B. Presence of nasal polyps. C. Persistent, purulent nasal discharge. D. Sudden onset of severe pain. Answer: C. Persistent, purulent nasal discharge. Rationale: bacterial chronic sinusitis is characterized by persistent, purulent nasal discharge that does not resolve over time. Mild symptoms or sudden onset severe pain are more indicative of acute sinusitis. Nasal polyps may be associated with chronic sinusitis, but are not characteristic of bacterial infections. 66. What is the role of surgery in the management of chronic sinusitis? A. To eliminate viral infection. B. To remove nasal polyps or clear sinus obstruction. C. To improve sleep quality. D. To prevent future sinus infections. Answer: B. To remove nasal polyps or clear sinus obstruction. Rationale: surgery may be indicated in chronic sinusitis patients to remove nasal polyps or clear sinus obstructions that prevent proper sinus drainage. Surgery does not treat viral infections, improve sleep quality, or prevent future infections. 67. In chronic sinusitis, what is the typical duration of symptoms before intervention is considered? A. 1 to 2 days. B. 1 to 2 weeks. C. 4 to 6 weeks. D. 8 to 12 weeks. Answer: D. 8 to 12 weeks. Rationale: symptoms lasting 8 to 12 weeks are typically when chronic sinusitis is diagnosed. Acute sinusitis typically resolves within 1 to 2 weeks, while subacute sinusitis lasts 4 to 6 weeks. 68. What is the first-line treatment for uncomplicated chronic sinusitis? A. Oral antibiotics. B. Nasal saline irrigation. C. Surgery. D. Intravenous antibiotics. Answer: B. Nasal saline irrigation. Rationale: nasal saline irrigation is a first-line treatment for chronic sinusitis as it helps flush out mucus, allergens, and irritants. Oral antibiotics are used only when bacterial infection is suspected. Surgery is a last resort, and intravenous antibiotics are typically reserved for severe infections. 69. In patients with chronic sinusitis and nasal polyps, what additional medication may be considered? A. Oral corticosteroids. B. Antihistamines. C. Antifungal medications. D. Decongestants. Answer: A. Oral corticosteroids. Rationale: oral corticosteroids may be prescribed to reduce inflammation and shrink nasal polyps in patients with chronic sinusitis. Antihistamines, antifungal medications, and decongestants do not address polyps directly. 70. Which of the following lifestyle changes may help reduce symptoms of chronic sinusitis? A. Smoking cessation. B. Increased alcohol consumption. C. A high-fat diet. D. Frequent use of nasal decongestants. Answer: A. Smoking cessation. Rationale: smoking cessation can help reduce inflammation and irritation in the nasal passages, improving sinus health. Alcohol consumption and a high-fat diet can exacerbate sinus symptoms. Frequent use of nasal decongestants may cause rebound congestion. 71. Which of the following is a common risk factor for developing chronic sinusitis? A. Regular exercise. B. Allergic rhinitis. C. Adequate sleep. D. Healthy diet. Answer: B. Allergic rhinitis. Rationale: allergic rhinitis is a significant risk factor for developing chronic sinusitis because it leads to inflammation and obstruction of the nasal passages. Regular exercise, adequate sleep, and a healthy diet do not directly increase the risk for chronic sinusitis. 72. Which of the following is the primary cause of chronic sinusitis in patients with immunocompromised states? A. Fungal infections. B. Viral infections. C. Bacterial infections. D. Allergic reactions. Answer: A. Fungal infections. Rationale: in immunocompromised patients, fungal infections, especially mucormycosis, are more common and can lead to chronic sinusitis. Bacterial and viral infections are less frequent in these patients. Allergic reactions are not a primary cause. 73. In chronic sinusitis, which of the following symptoms is most commonly associated with fungal sinusitis? A. Yellow-green nasal discharge. B. Nasal polyps. C. Sinus pain with facial swelling. D. Black necrotic tissue. Answer: D. Black necrotic tissue. Rationale: fungal sinusitis, especially mucormycosis, is characterized by black necrotic tissue, often seen in the nasal passages. Yellow-green discharge and nasal polyps are more common in bacterial sinusitis. 74. Which of the following best describes the role of endoscopic sinus surgery in chronic sinusitis? A. To remove nasal polyps and improve sinus drainage. B. To treat the underlying viral infection. C. To prevent future allergic reactions. D. To relieve allergic rhinitis symptoms. Answer: A. To remove nasal polyps and improve sinus drainage. Rationale: Endoscopic sinus surgery is used to remove obstructions like nasal polyps and improve sinus drainage in patients with chronic sinusitis. It does not treat viral infections, prevent allergic reactions, or relieve rhinitis symptoms. 75. Which of the following is most likely to result in the development of chronic sinusitis after an acute infection? A. Untreated bacterial infections. B. Viral infections. C. Overuse of nasal decongestants. D. Inadequate hydration. Answer: A. Untreated bacterial infections. Rationale: untreated or inadequately treated bacterial infections can result in the progression to chronic sinusitis. Viral infections typically resolve on their own, while nasal decongestant overuse and dehydration can worsen symptoms but are not direct causes. 76. In patients with chronic sinusitis, which of the following tests is typically used to confirm the presence of bacterial infection? A. Chest X-ray. B. CT scan of the sinuses. C. Sinus puncture. D. Skin allergy test. Answer: B. CT scan of the sinuses. Rationale: a CT scan of the sinuses is the most common imaging test used to confirm chronic sinusitis and assess the extent of the disease. Sinus puncture is not routinely used, and chest X-rays or allergy tests are not diagnostic for sinusitis. 77. Which of the following is not a common complication of chronic sinusitis? A. Nasal polyps. B. Chronic cough. C. Ocular complications. D. Migraine headaches. Answer: D. Migraine headaches. Rationale: migraine headaches are not a typical complication of chronic sinusitis. Nasal polyps, chronic cough, and ocular complications like orbital cellulitis are more commonly associated with chronic sinusitis. 78. Which of the following is a typical feature of chronic sinusitis with nasal polyps? A. Complete resolution of symptoms. B. Persistent nasal obstruction and reduced sense of smell. C. Rapid onset of fever and chills. D. A single episode of sinus pain. Answer: B. Persistent nasal obstruction and reduced sense of smell. Rationale: chronic sinusitis with nasal polyps is characterized by persistent nasal obstruction, reduced sense of smell, and sinus pressure. The symptoms are not typically self-limiting or associated with fever. 79. Which of the following is a risk factor for chronic sinusitis in children? A. Routine immunizations. B. Secondhand smoke exposure. C. Breastfeeding. D. High-fiber diet. Answer: B. Secondhand smoke exposure. Rationale: exposure to secondhand smoke is a significant risk factor for chronic sinusitis in children because it irritates the nasal passages and can lead to chronic inflammation. Routine immunizations and breastfeeding are protective factors, and a high-fiber diet is unrelated. 80. Which of the following is a non-pharmacological intervention for chronic sinusitis? A. Intravenous antibiotics. B. Oral antihistamines. C. Nasal saline irrigation. D. Oral steroids. Answer: C. Nasal saline irrigation. Rationale: nasal saline irrigation is a non-pharmacological intervention that helps rinse out mucus, allergens, and debris, improving sinus function. Antibiotics, antihistamines, and oral steroids are pharmacological treatments. 81. Which of the following organisms is most commonly associated with chronic bacterial sinusitis? A. Escherichia coli. B. Streptococcus pneumoniae. C. Pseudomonas aeruginosa. D. Staphylococcus aureus. Answer: B. Streptococcus pneumoniae. Rationale: Streptococcus pneumoniae is the most common pathogen in chronic bacterial sinusitis. Other organisms like Pseudomonas aeruginosa and Staphylococcus aureus can be involved, but they are more commonly associated with specific populations, e.g., immunocompromised patients. 82. What is the primary goal of treatment for chronic sinusitis? A. Complete eradication of nasal polyps. B. Reduction of inflammation and symptom relief. C. Treatment of all underlying allergic conditions. D. Elimination of all bacterial infections. Answer: B. Reduction of inflammation and symptom relief. Rationale: the primary goal of treatment is to reduce inflammation and relieve symptoms, which can include nasal congestion, pressure, and pain. Elimination of polyps, treating underlying allergies, and eradicating bacteria are secondary goals, depending on the patient's condition. 83. Which of the following is the best preventive measure for chronic sinusitis in patients with allergic rhinitis? A. Use of antibiotics. B. Avoidance of known allergens. C. Regular nasal saline irrigation. D. Long-term use of oral corticosteroids. Answer: B. Avoidance of known allergens. Rationale: avoidance of allergens is the best preventive measure for chronic sinusitis in patients with allergic rhinitis, as it reduces nasal inflammation. Antibiotics, saline irrigation, and corticosteroids may help manage symptoms, but are not primary preventive measures. 84. Which of the following is an indication for surgery in chronic sinusitis? A. Chronic nasal congestion with no relief after medication. B. Sinus infection lasting for more than 2 weeks. C. Severe facial pain that improves with rest. D. Frequent episodes of upper respiratory infections. Answer: A. Chronic nasal congestion with no relief after medication. Rationale: surgery may be indicated in chronic sinusitis when there is chronic nasal congestion or obstruction that does not improve with medications, often due to nasal polyps or anatomical blockages. 85. What is the most common type of chronic sinusitis? A. Bacterial sinusitis. B. Fungal sinusitis. C. Allergic sinusitis. D. Viral sinusitis. Answer: A. Bacterial sinusitis. Rationale: bacterial sinusitis is the most common type of chronic sinusitis, particularly in adults. Fungal and viral sinusitis are less common and typically present in specific populations. 86. Which of the following is most effective in treating chronic sinusitis symptoms? A. Long-term use of nasal decongestants. B. Chronic use of antibiotics. C. Nasal corticosteroids and saline irrigation. D. Oral antihistamines. Answer: C. Nasal corticosteroids and saline irrigation. Rationale: nasal corticosteroids and saline irrigation are the most effective treatments for chronic sinusitis symptoms by reducing inflammation and improving sinus drainage. Long-term decongestant use can lead to rebound congestion. 87. Which of the following treatments is typically avoided in chronic sinusitis due to potential side effects? A. Oral antibiotics. B. Nasal corticosteroids. C. Long-term use of nasal decongestants. D. Nasal saline irrigation. Answer: C. Long-term use of nasal decongestants. Rationale: long-term use of nasal decongestants is avoided because it can cause rebound congestion and worsen symptoms. Other treatments like oral antibiotics, corticosteroids, and saline irrigation are typically used with careful monitoring. 88. Which of the following is true regarding the management of chronic sinusitis in children? A. Surgery is recommended for all cases. B. Antibiotics should be prescribed for every patient. C. Nasal saline irrigation is commonly used as a first-line treatment. D. Chronic sinusitis rarely occurs in children. Answer: C. Nasal saline irrigation is commonly used as a first-line treatment. Rationale: nasal saline irrigation is a first-line treatment for chronic sinusitis in children as it helps clear mucus and allergens. Surgery and antibiotics are reserved for more severe or complicated cases. 89. Chronic sinusitis can lead to which of the following complications if left untreated? A. Asthma exacerbation. B. Sore throat. C. Hearing loss. D. Cerebral abscess. Answer: D. Cerebral abscess. Rationale: if left untreated, chronic sinusitis can lead to severe complications like a cerebral abscess, which is a life-threatening condition. Asthma, sore throat, and hearing loss may occur but are not as directly linked to untreated sinusitis. 90. Which of the following is a common symptom of chronic sinusitis? A. Sudden severe headache. B. Chronic nasal congestion. C. Rapid weight loss. D. Extreme fatigue with fever. Answer: B. Chronic nasal congestion. Rationale: chronic nasal congestion is a hallmark symptom of chronic sinusitis. Sudden severe headaches, weight loss, and fatigue with fever are not typical for chronic sinusitis but may be seen in other conditions. 91. What is a common cause of sinusitis in individuals with cystic fibrosis? A. Allergies. B. Bacterial infections. C. Fungal infections. D. Viral infections. Answer: B. Bacterial infections. Rationale: in individuals with cystic fibrosis, chronic sinusitis is often caused by bacterial infections due to thick mucus buildup in the sinuses. 92. What is the primary purpose of nasal saline irrigation in treating chronic sinusitis? A. To reduce sinus swelling. B. To remove allergens, irritants, and mucus. C. To treat bacterial infections. D. To increase nasal mucus production. Answer: B. To remove allergens, irritants, and mucus. Rationale: nasal saline irrigation helps remove mucus, allergens, and other irritants from the nasal passages, which can reduce inflammation and improve sinus drainage. 93. Which of the following conditions may be a predisposing factor for developing chronic sinusitis? A. Good hygiene practices. B. Gastroesophageal reflux disease (GERD). C. Regular exercise. D. High fruit and vegetable intake. Answer: B. Gastroesophageal reflux disease (GERD). Rationale: GERD can contribute to chronic sinusitis by causing acid to irritate the upper airways, leading to inflammation of the sinuses. 94. Which of the following is a common treatment for chronic sinusitis with nasal polyps? A. Oral antihistamines. B. Systemic corticosteroids. C. Decongestants. D. Antifungal medications. Answer: B. Systemic corticosteroids. Rationale: systemic corticosteroids can help reduce inflammation and shrink nasal polyps in patients with chronic sinusitis. Antihistamines, decongestants, and antifungal medications are not typically used for this purpose. 95. What is a characteristic finding in the CT scan of a patient with chronic sinusitis? A. Clear, open sinuses with no fluid. B. Thickening of the sinus mucosa. C. Presence of a single small polyp. D. Enlarged nasal turbinates with no obstruction. Answer: B. Thickening of the sinus mucosa. Rationale: a CT scan of chronic sinusitis often shows thickening of the sinus mucosa, which indicates inflammation and blockage. Polyps or obstruction may also be seen but are less characteristic. 96. In chronic sinusitis, what is the purpose of using intranasal corticosteroids? A. To reduce swelling and inflammation in the nasal passages. B. To treat bacterial infections. C. To relieve pain. D. To kill fungi. Answer: A. To reduce swelling and inflammation in the nasal passages. Rationale: intranasal corticosteroids reduce inflammation in the nasal passages, improving drainage and reducing symptoms of chronic sinusitis. They do not treat infections directly. 97. Which of the following complications is associated with untreated chronic sinusitis? A. Asthma. B. Pneumonia. C. Orbital cellulitis. D. Gastroenteritis. Answer: C. Orbital cellulitis. Rationale: orbital cellulitis, an infection of the tissues around the eye, can be a complication of untreated chronic sinusitis, particularly if the infection spreads. Asthma, pneumonia, and gastroenteritis are not direct complications of sinusitis. 98. How long must symptoms persist for chronic sinusitis to be diagnosed? A. Less than 1 week. B. More than 10 days. C. More than 12 weeks. D. More than 6 months. Answer: C. More than 12 weeks. Rationale: chronic sinusitis is defined by symptoms that persist for more than 12 weeks, despite treatment. 99. What is the role of oral antibiotics in treating chronic sinusitis? A. To cure viral sinusitis. B. To treat bacterial infections if present. C. To reduce inflammation in the sinuses. D. To prevent fungal infections. Answer. B. To treat bacterial infections if present. Rationale. Oral antibiotics are used when a bacterial infection is suspected or confirmed in chronic sinusitis. They do not treat viral infections, inflammation, or fungal infections directly. 100. Which of the following is a potential side effect of prolonged use of nasal decongestants in chronic sinusitis? A. Rebound congestion. B. Improved sinus drainage. C. Reduced nasal polyps. D. Prevention of bacterial infections. Answer. A. Rebound congestion. Rationale. Prolonged use of nasal decongestants can lead to rebound congestion, worsening symptoms of chronic sinusitis. They should be used sparingly and only for short durations.